Colorectal cancer is one of the most common cancers that we see in the United States. There's over 1 million survivors of colorectal cancer living right now in the US. The good thing is that since 1970, the death rate from this cancer has been cut in half. And the even better news is that we're doing much better with our treatments and our options than we were several years ago. Some of the early warning signs for colorectal cancer include changes in your bowel habits. You might have thin, narrow stools, worsening constipation, potentially even diarrhea, abdominal pain, fullness, or blood in your stools. Screening for colon cancer is really important. You can do this by a colonoscopy or even a stool test that looks for microDNA in your stool that could be indicative of a cancer. It's very important that we detect colon cancer early, and our goal here is really to avoid more invasive procedures like surgery or even chemotherapy being needed. So any new diagnosis of any type of cancer, colon cancer included, is very scary. The first thing that I always tell patients to do is to take a deep breath and to recognize that in many cases, colon cancer is curable. We have great new surgical techniques and chemotherapies that can help us to avoid this cancer from recurring, and luckily you're in a great health system with lots of options. Colon cancer is actually divided into 5 stages. We start with stage 0, which is the earliest stage. This is where the colon cancer is really just on the surface of the colon on the inside, and this can typically just be removed endoscopically by your gastroenterologist during a procedure like a colonoscopy. The most advanced form of colon cancer is considered stage 4, and that's the case where the cancer itself has spread to other organs or significantly beyond the colon itself. There's a lot of different treatment options for colon cancer today. They're sometimes as simple as just a resection via colonoscopy, and oftentimes complicated and involving a bigger surgery. Luckily, the surgical techniques have improved a lot in the last several years, and the surgeons are very skilled in removing the cancer. Oftentimes, though, you may need chemotherapy in order to either prevent a recurrence of that colon cancer, or if the cancer has spread already, to treat that colon cancer and shrink it down. Please rest assured that if you have a recent diagnosis of colon cancer, there is a lot of hope. Our techniques have gotten much better for treatment, and early detection here is really key. Just see your doctor as soon as possible.